subject, insomnia. What about that? How do you treat that?
Well, insomnia is really broken up into different kinds. There's people that have difficulty falling asleep, and then if people have difficulty staying asleep. So some people that have difficulty going to sleep, it could be for psychological reasons, they may be stressed, but they may have another common problem called the restless leg syndrome. Restless leg syndrome affects probably about 10% of the population. Not to say that 10% of the population will require treatment, because it may not be a nightly problem, but it may be more like 4% of the population may have restless legs to a degree that needs to be treated.
And does that wake you up?
Well, there are leg movements that can occur in the middle of the night in people that have restless legs, and these leg twitching movements can wake you up.
Right.
And they also result in you having non-restorative sleep. It can result in daytime sleepiness.
So what do you do for that?
There's certain medications that we can use, and we now realize that this is a problem with dopamine, actually. Dopamine functions almost like a filter within part of the nervous system, and by not having enough of this dopamine, there's signals that get through that it's almost like a static of the nervous system, and it creates a sensation of restlessness. So a person moves their extremities, particularly the legs, to drown out the static. So the stimulation of movement drowns out this restless sensation. By increasing dopamine, we increase the strength of that filter, and we're filtering out the static sensation. So dopamine actually works well. But you can also have this problem as a result of an iron deficiency.
So let's talk a little bit more in depth about what Dr. Simmons was discussing in that video. So with restless legs, I typically like to start with a ferritin level. A ferritin is your iron stores. We want it to be on the higher end of normal, typically 75 or higher. I also like to check the medications that you're taking. There are certain medications that can exacerbate the symptoms of restless legs, such as antihistamines and certain antidepressants. Then there are lifestyle modifications that we can recommend, like avoiding caffeine, especially in the afternoon, going for a nice walk, especially earlier in the day, having a nice hot bath right before bed, a leg massage, as well as a consistent bedtime routine. If none of this helps to reduce your symptoms and they're still pretty bothersome, then there are some medication options for restless legs. So like Dr. Simmons was explaining, restless legs is like having static in the nervous system. It's like the signals between the brain and the legs are noisy and not being filtered well. And so the dopamine agonist, such as your pramipexole, your ropinirole, or your Nupro patch, help by increasing the dopamine, which turns up the brain's natural filtering system. So they screen out more of that static. When the filter works better, that uncomfortable urge to move is reduced. Restless leg syndrome happens because of abnormal signaling in the brain pathways that control movement and sensory discomfort. The medications we use work in a few key ways. First-line medications like gabapentin and pregabalin calm overactive nerve signals and reduce uncomfortable sensations, especially at night. Gabapentin anacarbil, or Horizon, is a long-acting form that provides more stable medication levels through the evening and night. If needed, dopamine agonists such as your ropinirole and pramipexole help replace or stimulate dopamine, a key brain chemical involved in movement control. The Nupro patches also deliver dopamine stimulation but continuously through the skin, which can help patients with symptoms that last all day. For severe or treatment-resistant cases, low-dose opioids like tramadol or methadone reduce pain signaling and suppress the urge to move the legs. The goal of treatment is to quiet abnormal signals so symptoms improve and sleep can be restored. We now have a non-medication option to help treat restless leg syndrome. Nidra by Notrix is a wearable device that uses gentle electrical stimulation to calm the nerve signals that cause the uncomfortable urge to move the legs. What's exciting is that it offers a drug-free option patients can use on its own or along with medications, without medication side effects or the risk of symptoms getting worse over time. Regardless of what treatment option you choose for restless legs, it's definitely catered to each patient and their needs. I hope all this information was helpful. Have a great rest of your day.